Well, I'm Chip Spenning, as you know, Executive Director of Franklin County Children's Services. I'm joined here today with Dan Shook, who is our new CFO. And so appreciate you guys providing us this opportunity today. Before I begin, I'd like to express my appreciation to the county commissioners and to the county administrator, Ken Wilson, as well as our board, staff, alumni, volunteers, providers, partners, the many donors, and the community members who really support children's services. Additionally, I'd like to express my appreciation to Governor DeWine for his increased support in child welfare in Ohio for 2020. 2020 has brought significant challenges to all of us due to the health and social injustice pandemics. Your guidance and direction has provided continued services to the children and families of Franklin County and has been greatly appreciated. Your leadership and the communication has been a significant support to this agency and has helped us strive for best practices through this unprecedented time. Our agency's efforts during this time have expanded to the response of the changing and emerging needs of our staff, families, and children. Highlights of our COVID-19 response plan, and as outlined in the Rise Together blueprint for reducing poverty in Franklin County, will highlight our diversity, equity, and inclusion efforts. For our local collaborations, we've continued to align our efforts with local and state governments, securing mandates to policy and directive. Management teams have remained connected regularly, scheduled through teleconference calls to ensure the most current information is conveyed to staff. Managers have also been participants in various city and county COVID response teams in sharing practices and innovations. For facilities management, our agency locations have been fully cleaned and disinfected, particularly our high-touch areas and our areas with greater person access. Signage and detailing for occupancy for work, meeting, and training spaces has been posted. Additionally, markings for access to open areas has been identified to ensure at least 6 feet spacing apart. For teleworking, we have been able to develop teleworking agreements with our staff with an effort to address agency mandates while acknowledging the need for health and safety. Plans for engagement for each division and department have been made, identifying the most critical functions to be performed. The increased use of technology has been significant in our ability to ensure communication and productivity. All agency staff have been provided with devices to perform their assigned tasks from home. Further, with Microsoft Teams and other teleconferencing tools as resources for scheduling, meeting management, and conferencing both internally and with local and state government teams and county partners has been an effective tool. For community outreach, our agency response has included a community outreach campaign, encouraging the support of the community to assist the agency in reporting possible abuse and neglect. Additionally, an information campaign was begun to provide resources and supports to families experiencing stress and other challenges, particularly due to the pandemic. Our community has grown and shown great support for the agency at this time. There has been a significant response and appeal for hand-sewn masks early in the spring. The community supporters have also asked how they can participate in an effort to ensure the ability to respond safely to our families. We've received over 2,000 donated masks. There have been some letters of support from the community, citing recognition and encouragement for the work that our staff has done. For training of our staff, virtual training opportunities have been expanded for staff to address their needs. We have contracted with nationally recognized online program, specifically for child welfare practice to support our caseworkers and supervisors in training and development. Other approved programs through local universities and professional sites have also been accessed to meet the needs of our other staff. Diversity, equity, and inclusion efforts. With the onset of the current health and social injustice pandemics, we've broadened our scope and response with staff and the community. Recognizing the disproportionate impact that COVID-19, racism, and inequality, these efforts specifically address the societal conditions were heightened. Through a focused programming with our Diversity, Equity, and Inclusion Division, increased efforts were aligned and targeted to specifically address racism, inequality in our communities. With our DEI's evaluative efforts, the agency has formally examined the issues of disproportionality, specifically to the agency's service impact. Information has been made available to the areas of mandated reporting, service provision, and placement decision making. Comprehensive focuses has been completed to enhance our understanding, our response, and programming with regard to service provision of our Black and Brown children in particular. And strengthening the agency's efforts towards enhanced programming and cultural response, town hall sessions have been facilitated for all agency staff. These opportunities have provided a means of targeted discussion and response specific to our strategic planning with an equity lens. The internal support for our staff has grown and expanded into an effort aptly named Saving Grace. Guidance, recognition, appreciation, connection, and enrichment. This is the theme of the ongoing staff campaign for sharing, supporting, acknowledging staff, units, and departments while also allowing professional growth, vulnerability, and development. Additionally, we've partnered with external organizations to support staff with virtual supports, resources, and education to assist them during this time. In the wake of the pandemics this year, there has been a recognition of the increased need for structured and strategic response on the part of the agency. In accord with the Board of County Commissioners, FCCS declared racism a public health crisis. By resolution, this declaration is the agency's formal statement and commitment to eradicate injustice, inequality, and racism. Additionally, the agency declared its focus on the review of policy and procedure, education and training, focused strategies towards improved outcomes. The areas mentioned here continue to inform and support the agency's change journey. Embedded in the concepts of safety science and allowing for greater emotional and workplace safety, we have taken the challenges of increased and enhanced program delivery and staff support. While much change has occurred, our mission and vision still hold true. Our mission is through the support of families and their communities. We advocate for the safety, permanency, and well-being for each child in a manner that honors and serves family and culture. Our vision is the safety and permanency and well-being for each child. Franklin County Children's Services cannot achieve our mission and vision alone. We accomplish this with the help of 850 employees, more than 100 agency and organizational partnerships, 500 kinship families, 200 adoptive families, 500 volunteers and mentors, and hundreds of community foster parents and thousands of Franklin County property owners. Generally, each year the agency receives more than 32,000 referrals and completes about 13,000 investigations. However, reports of abuse and neglect declined considerably at the onset of COVID-19. In comparison, the statistics in 2019, the numbers of referrals and corresponding number of intake assessments completed during the same time period were approximately 30% less due to reduced visibility of children by mandated reporters. With the opening of some in-person classes by some school districts and the reopening of child care centers, along with some normalcy in Franklin County, we're beginning to see some of these numbers increase. Daily, there are over 5,500 children on open caseloads where more than half of those children are served in their own homes. With less than half those children in substitute care placements, which is needed to ensure their continued safety. Of the children in substitute care placements, about 40% are placed with approved kinship care providers. When children must be removed from their homes due to safety concerns, placement with kin reduces the trauma associated with removal, ensures better long-term outcomes, and has resulted in fewer disruptions in placement. We continually seek kin to help the needs of children. They have been vital in our response, and we continue to seek grandparents and extended family members taking on the care of children. Our kinship program has grown significantly over the last several years. Since 2015, there's been about 22% shift in placement days from substitute care placement to kinship care. To ensure the stability of our kinship families, we have 2 specialized units that focus specifically on the support and case management. Further, we provide financial and material support, which includes monthly stipends, assistance with daycare, summer programs, food, and clothing assistance. Beginning in 2018, through a collaboration with Franklin County Department of Job and Family Services, we received a kinship care program grant, which supported low-income kinship families. Since its inception, we've provided $2.8 million to 1,168 families, just a little over 2,000 children, to assist those families to include rent, assistance with mortgage payments, utilities, food, clothing, school, event fees, and uniforms. The continued growth in this area becomes even more important upon the implementation of the Family First Prevention Services Act, which was passed by Congress in February of 2018. In October 2019, the federal government ended a national waiver program due to the passage of the Family First Prevention Services Act. We, Franklin County Children's Services, was one of 18 counties in Ohio that entered this federal Title IV-E program. In 1998, it was called the Protect Ohio waiver. This program provided flexible funds and allowed for additional services to be provided to families. With the end of the waiver program, FCCS has experienced a reduction in federal funds and support services to be provided to children and families. As federal funding makes up about 26% of our annual revenue, our financial department, or our fiscal department, is working diligently to identify alternatives to funding opportunities to close this gap. Beginning in October of 2021, Ohio will implement the Family First Prevention Act, which again was passed by Congress in February of 2018. This legislation aims to prevent children from entering foster care by allowing for federal reimbursement for prevention services. FCCS has already improved our prevention services and improved our family stability by providing in-home services and reducing our reliance on congregate care. Receiving federal reimbursement for prevention services under this act may help offset our current and future losses in federal funds. Franklin County Children's Services makes every effort to maintain children safely in their home. Of the current cases, 53% of the children and their families are receiving in-home services to stabilize their family and prevent removal. Since January of 2020, the services have shifted an average of the number of cases in-home per day by 10%, thus reducing placement in agency custody. Also, over time, we've significantly reduced our reliance on congregate care by 31% from 2015 to 2020. Although these key tenets of this legislation are consistent with the direction of the agency, exhaustive preparation for the Family First Prevention First is key to our success under the new federal law. To ensure our full preparedness, we've created a Prevention Services Pathway Implementation Team to review agency policies and protocols related to eligibility, services, evidence, criteria to evidence-based prevention services, infrastructure needs, and federal funding opportunities. Currently, upon the implementation of Family First and providing the highest quality services and best practice standards for families is essential to achieving positive outcomes for our children. To ensure that we continue to meet these high standards, the agency engages with the Council on Accreditation, or COA. It's an international, independent, not-for-profit human services accrediting organization. COA processes can be quite rigorous, but it aligns with our commitment to ensure highest quality of services and best practice standards are provided to Franklin County's children and families. Franklin County Children's Services is one of the few agencies in Ohio to be accredited and will undergo reaccreditation in 2021. Supporting and strengthening our workforce is essential. Safety, permanency, and well-being applies to our families and children, but it also applies to our staff. We've also had COVID-19 has had a profound effect on how we serve our families, thus causing us to take a more proactive approach in how we protect the psychological and physical health of our workers. Implementing the implementation of our #SavingGrace, equity town hall meetings, and establishing an open dialogue policy with workers to discuss issues that affect them personally and professionally. Child welfare is a labor-intensive field. Strong, stable workforce is the precursor for our ability to provide safety, permanency, and well-being for our children. For safety, much of the work the child welfare worker does takes place in the community, and COVID-19 has changed the way in which we provide safety to children in the community. Caseworkers are now able to conduct visits virtually, although they do still continue face-to-face visits when families and individuals are in crisis to ensure safety by wearing masks and taking precautions to prevent the spread of COVID-19. Our staff must feel the support both internally and externally to feel safe while providing these services. Permanency. Retention and stability is important to FCCS. High turnover at the agency causes heavier caseloads on other workers, which then in turn causes burnout and ultimately result in more workers leaving the agency. The loss of workers means a loss of expertise, leading to a reduced capacity for specialized case management. Well-being, there's a lot of research regarding secondary trauma in the child welfare worker. Secondary trauma occurs to individuals exposed to people who have been traumatized themselves. According to the National Child Trauma Stress Network, the essential act of listening to trauma stories may take an emotional toll and compromise the professional functioning and diminish quality of life. It's also referred to as secondary trauma, very similar to PTSD. So individuals and supervisory awareness of this effect on the indirect trauma, the exposure is a basic part of protecting the worker and ensuring that children consistently receive the best possible care from those who are committed to helping them. Not only do we need to help ensure that our workers remain mentally and emotionally whole, they need to be afforded the opportunity for solid work-life balance. Working from home has created a shift in management and staff responsibilities. We have, however, been able to create responses that are reliable and verifiable to meeting agency mandates. Having a workload that can be managed weekly is vital to achieving work-life balance. The agency has implemented many initiatives to impact safety, permanency, and well-being for our workers. We've reduced our worker to supervisor ratio at intake to allow more time to be provided to support each worker. We've improved recruitment, onboarding, and orientation of new staff. We have mentors and floating staff to support and provide additional coverage. We've modified our training to better integrate hands-on experience in classroom learning. We have a peer support program. We've increased our administrative support. These are just a few initiatives that have been implemented at the agency, and we're beginning to experience some positive results from staff stabilization through these efforts, and have seen a turnover rate decline from 2020 by 6% from the rate in 2019. We still have a long way to go, but we're headed in the right direction. We know that strong, competent, experienced staff with low turnover and manageable caseloads will have a significant impact on positive outcomes for families. Community support. Child abuse and neglect is a community responsibility, and we know that it takes an entire community to protect the child. Partnering with the community allows us to create relationships that provide a holistic approach to support children and families. The problems that our families face are often complex, requiring many different services to solve. Finding the right service to match the challenges that our families face is important in helping them achieve their goals and their children returning home safely. In working with families, we find that there's no one magic solution or answer. Complex problems require the support of multiple services that are vital with our community partnerships. Some of the partnerships that we'd like to highlight this year, we have a partnership with the Educational Service Center in support of our shared objective that no child should be left behind. The work is also to reduce the persistent racial achievement gap, also to ensure that our youth have the supports that they need to graduate from high school. We have a partnership with Rapid Response, which is a diversion program at the court. It provides support to families, linking them to resources sooner and providing better options to youth to remain in the home and in the community. This is really great for our teens. With the Board of Developmental Disabilities, to support families facing challenges with children with disabilities, recently we jointly established an in-county placement option for children with severe autism that didn't require the parent to relinquish custody to Children's Services. We partner with Job and Family Services to increase the number of children in safe and stable homes and environments by ensuring that the shared families that we share understand and apply for available benefits. This often helps improve the stability of the family unit. With Adam, counseling has always been an important factor in our partnership and providing community services, but the opioid epidemic has intensified this partnership. We also strive to ensure that the youth voice is acknowledged in all the work that we do. With our internal youth advisory board, it enables young people the support of each other to share their feelings and experiences. They also provide feedback to the agency about what can be done to improve services to children in the foster care system. Our list of community providers is extensive. Being able to partner with over 100 organizations in addition to family members can professional service providers, managed care programs, and others allows the organization to support families in crisis. It's our shared objective to find healing from past situations and give direction and guidance towards a safer, brighter future. Well, this has been a year like no other year before. The agency has still been able to recognize the successes of families, staff, and partners with whom we work. Although our annual child abuse prevention breakfast was canceled, we were still able to award Jack Donahue and Alvin Hadley scholarships to youth and recognize those who overcame obstacles with the Rising Up and Moving On awards. Additionally, we recognized and awarded parents and kinship families with awards, as well as the Nancy Fitzgibbon Child Protection and Caseworker of the Year award. We are pleased that Public Children's Services Association of Ohio gave FCCS youth Sierra Ritchie and Mark Maley Rising Up and Moving On awards, and Thomas and Leah Perkins Kinship Family of the Year awards. We're also grateful to have held a successful Holiday Wish and Black Girl Magic campaign that provides gifts to more than 6,500 youth, thanks to the generous donations of the community. We're particularly pleased to be able to give our children of color gifts that reflect their culture and their unique identities. In addition, we celebrated 55 graduating youth with a drive-by graduation celebration this summer. We look forward to meeting the challenges in the coming year with a continued support with the commissioners and the community. We have worked hard with the Office of Management and Budget to create a jointly agreed upon budget for 2021, and I ask that the proposal be accepted and approved. Thank you for your support and your leadership, and we'd be glad to answer any questions that you may have.
Anybody go first? Okay. I want to again thank you, Chip. I don't get to interact with you that much, but I know your agency is a substantial part of the people that we're working really hard to make a better life for, and so we appreciate your work. One thing that jumped out at me, you're a levy-funded agency, and so I always feel like there's this dynamic of how do we as commissioners sort of engage you with the things that we care about in that way. But you brought it up, so I'm going to take a stab at it, and that's the equality and inclusion effort that you talked about, and you talked about it, I felt like, more from a programmatic standpoint. And I'm curious as to, are you looking at diversity and inclusion in terms of hiring, contracting, and with your board membership? And the reason why I feel like that's so important, it's as important as the programmatic part, is because it becomes systematic when all of the elements where you deliver services through sort of embrace that kind of effort. And so if you don't mind, maybe just talk about your own hiring, contracting, board membership, and that kind of thing with regards to D&I work.
Yeah, I think you're 100% right. We need to figure out how to make sure that it's embedded in every process that we have throughout the agency. I talked a little bit about some of the work that we've done around recruitment and that work. I do just have some numbers here to give you an idea, because I'll report out to my board every year, and I'm doing that right now. So as an example, when we talk about leaders of color and growing the organization to make sure we represent the communities that we serve, in 2012, we had 29 leaders of color, and today we have 70. So that's a 141% increase over that time period. But that's by making sure that all the interview panels that we have are made up of diverse interviewers, making sure that we're providing training opportunities and mentoring opportunities for all our staff. From a contracting standpoint, it's a space we need to do a better job with. We've currently been having conversations about how do we restructure the way we do our RFPs, the way we look at scoring, the way we make sure we have diverse panels to evaluate that work, and really engaging from a contracting standpoint, some other places that historically we haven't done as well with. We've generally contracted with more larger entities, but we need to have more specialized services. Our families have complex needs, and they need to have specialized services that meet their needs. So doing a lot of work in that space. We've been active really for quite some time with our, we have a multicultural development team that's been in place for a long time. And we're applying equity lenses to our policies. There's 3 questions in equity that we want to look at with anything that we're doing. What are we doing? Why are we doing it? Who's impacted negatively or positively? So when we start targeting those populations, we're making sure that decisions that we make, will benefit the families and children that we serve, and disaggregating all of our data by race, by age, gender, so that when we look at data, we always see who's impacted in a positive or negative way, so that then we can make adjustments. So it's work that we've been working on for quite a period of time. Sean Carter is the assistant director in that space, DEI work, and we've really made great progress. These town halls specifically focused on equity, I think has really been quite significant for us through this time period. We just had one today. We've had 10 town halls now, open to all agency staff, speaking around equity work pretty significantly. And, we had 138 staff members on these calls, and it's having these specific conversations. The truth is, FCCS and whatever we do, we're a summary of all the decisions that everybody in the organization makes. And so those outcomes make that up. And so if we want to change the outcomes, how do we create structures, environments, and processes to make sure that everybody in the organization has a say in what we do, that we create an organization that has a level of psychological safety, so that the caseworker engaging with the family can be heard to say, we need these services, or we need this path for this family. And so that's a lot of the work that we're working on.
And does that include your leadership? Does that include board membership too?
We have had some board members on there. We definitely invite them.
Okay.
Elon Sims was participating in one of them. I will say that also, after we had our declaration of racism for our public health crisis, we also put together training specifically around structural racism and how does it dismantle it, that all staff are required to take. It's a 6-hour training broken up in 6 different modules. And we also provide the same training, well, an overview of the training to the board in that regard.
Okay. All right. Thank you.
I don't have any questions, Chip. Thank you. Great work.
Thanks, Sean.